Florida Medical Clinic sees over 3,000 patients a day.
We wanted really a seamless product, everything from scheduling, appointment scheduling, and doing a lot of the front and back office stuff and making sure that that was integrated with and seamless with what was happening on the clinical side of the practice.
A patient in our practice could easily have had 10 different charts at 10 different locations, and it made it very difficult for our providers to be able to manage the patient from all clinical perspectives. The business aspects, the billing and collection process had been standardized many years before, but now with the unified patient record, we really had something really unique to work on, which is really standardizing how we take care of our patients.
The Intergy product for us was just, it had everything we were really looking for.
Well, Florida Medical Clinic had been a long established client of Medical Manager. So we kind of had a unique opportunity to kind of watch Intergy grow from the inside. And we reached a point where in our own practices, it was a natural development to kind of roll right from Medical Manager right into Intergy and EHR.
Our partnering with Sage was first and foremost based on past relationships with the company. That was very important.
You may find it interesting, but Florida Medical Clinic did not go out and evaluate multiple vendors regarding their medical health record. We partnered with experts that we were comfortable in dealing with. It has become an absolute strategic advantage for us with our patients and in the marketplace to be able to provide this level of service.
One of the biggest benefits is the fact that we, in this large multi-specialty group, have a unified patient chart.
At the end of the day, doctors now have one source of contact information, one place to go to, everything consolidated. So if they want to look at labs, images, records, diagnostic stuff, consulting reports, it's all in one location.
We can even access the chart from home as well if the need arises.
Our providers love the fact that they have access to everybody's notes. It gives them a clear insight as to what's going on with the patient, what's been done to the patient, what needs to be done with the patient. And again, it's all laid out in a very organized fashion so the provider can really take advantage of that.
Each doctor is able to make a decision regarding how they want to best use the product and what works best for them. Encounter Note gives you the ability to document based on a certain visit type. So if the patient is there for a particular chief complaint, the Encounter Note product can be designed so as to address the issues that you would want to address for that particular problem.
Some of the new features, including predictive order management tab, along with the health tab, I think are going to continue to be, revolutionary products for us and helping us continue to take good care of our patients.
Dictation was costing this particular clinic a significant amount of money, greater than 7 figures a year. And so one of the buy-ins into the product, and one place where we thought we would get a return on investment was being able to move some of that dictated documentation to possibly using more of a structured, form-driven documentation that you can get with Encounter Note.
Staff have been hugely affected in a very positive way.
Providers are using the tasking system to communicate with each other frequently regarding a patient that we have in common, or to clarify something that may have been documented in a note that needed further clarification. The nice thing about tasks is that it's asynchronous. We don't have to be necessarily able to communicate with each other at the same time because when you get a bunch of providers all pretty busy, so the ability to communicate asynchronously is really important.
Access is the key. You can be much more efficient if you can simply access the information, and that's what the EHR lets you do.
Well, that whole system works a lot more efficiently when you have lab results that are returned to you electronically rather than by paper.
Prescription refills are where you get your biggest bang for your buck in the Intergy system.
With electronic refills and electronic prescriptions, we're able to move a lot more quickly, therefore improving turnaround times.
The automatic eligibility verification process, I think, been a huge issue for us. Number two, I think the multiple fee schedules by provider, by plan, has been a huge issue. The electronic remittance activity, the claim scrubbing capabilities, all of those things, when used appropriately, help drive down your accounts receivable days. The name of the game is, how do I take care of patients and how do I get my money in as fast as I can?
I think that Sage has helped us better manage the revenue cycle by providing the analytical tools that we need to see what's going on a real-time basis.
Clearly, we are more efficient using the Intergy EHR system than we were before. Our business in the last 2.5 years has probably grown anywhere from 30 to 40%.
Our claims are definitely more accurate and complete before, particularly because of the ability to utilize the claim scrubbing product that Sage offers. That's allowed us to ensure that the claims go out in a much cleaner fashion than they did previously. Due to the accuracy of the claims in the Sage product, we've actually seen a decrease in our AR days.
Our AR days are as low today as they've ever been. In fact, I think last month we reached 27 days in a true multi-specialty group practice is pretty impressive as far as I'm concerned.
I like the flexibility that the product provides, and its accuracy is uncanny. We've been able to locate issues with lab billing and then circle back with the lab and ensure that we optimize what's being done in the lab so as to make sure the claims go out properly on the first pass.
So that mere fact that you can mine the data within the chart makes a big impact.
It allows you to have better access to the clinical information, which I think at the end of the day produces a better result for the patient.
We use Sage Practice Analytics to pull a lot of key indicator data related to accounts receivable days, as well as patient balances, which are becoming more and more of a part of the collection cycle, and to understand how our collections on patient balances compare to industry norms. We also look at individual physician performance metrics versus the marketplace and, of course, against our own expectations and prior year data. And we've been able to do some comparative analytics using the practice analytics tool that lets us look at the physicians in the practice against their peers in the same specialty to ensure that the coding is pretty much on the same level.
The patient response to the electronic health record has been absolutely overwhelming. In fact, so significant that we even considered marketing the fact that we had an electronic health record that everybody within our practice had access to. Patients get very frustrated. They may be seeing 2, 3, maybe even a half a dozen different doctors. And it's very difficult for them to keep up as to who's done what, what's the next step, et cetera, et cetera. The ability to have a doctor be able to look very quickly at the other providers, at the other doctors that have seen that patient, and tell the patient, look the patient in the eye and say, I see what they're thinking here. You don't have to explain it to me. I know it's difficult for you to do. That has been an absolutely positive thing, and the patients very much appreciate us having that.
I think the integration of electronic health record is probably the most revolutionary program that someone can put into their practice.
As we move forward, we're looking at new ways to optimize processes that maybe we set up in the beginning that we now see that have some potential to be even more efficient as we understand the product better.
You have a team of people that will help you walk you through the process. It is completely re-engineering your entire practice from how the patient checks in to how the patient checks out and everything in between. So the comfortable thing for us is dealing with people we know, and the expertise was there in helping us with whether it was transition from conversions or to processes, but it's a very complicated process, but very worthwhile, and you deal with people who know how to do it.
There's no provider, no physician in our practice who at this point of where we're at would ever go back to where we were at previously.
I mean, the overall Sage experience for us is, to me, it's all about relationships, all right? The product has to perform, okay? But at the end of the day, with any system, you're gonna have issues. And the question is, are they gonna be there when you need them when you have an issue? And the answer to that is with Sage is absolutely.